Afternoon.
Well,
We're going to talk a little bit about your experience in medicine and go over what it is that brought you into medicine and what you've enjoyed about it, what experiences you've had, and what you've seen changing in Worcester over all these years. Let's start with just what attracted you to medicine. What made you decide? How old were you when you decided?
well, when I graduated from high school in Southbridge, I thought I would go to osteopathic school. You could go directly from high school into that. I had an aunt and uncle in Boston that were osteopaths. But my brother-in-law was Dr. Joseph Millen, and he came and said to my mother, if she's thinking about going into medicine, why doesn't she do it the right way? Well, then we found out that you had to go to college for 4 years first, and then to medical school. So we had the book already on Tufts, and so it was the end of the summer, and I had been in camp all summer working as a counselor, and suddenly I was going to go to college. I'd never been there or never knew what it was all about, but couldn't afford to live in a dormitory even though I came from Southbridge. So I lived in Wellesley Hills with my aunt, the doctor, so commuted from Wellesley Hills to Medford to go to college. And that was an experience. I'd never been on a subway or seen one or anything else. So anyhow, I learned the ropes of that, but it took a long, long time. And to get to school, it was worse coming home because at least going, you got the buses at the right times, but coming, you'd have to stand. I stood at Longwood tennis courts waiting for the Boston Worcester bus for hours, it seems like. But at any rate, I got to college and said I was a pre-med, but they didn't have that kind of a course. So you either had to be a biology or a chemistry major, and I'd never had biology. We didn't have it in Southbridge. So I became a chemistry major for 4 years. And then, as I said, instead of going on, that meant I had to go to put in my application at Tufts Medical, and was accepted. I don't know why, but anyhow, I got accepted. And we had a big class. We had 8 women in our class. It was the biggest class women that they had had. And it was quite an experience. I had to find a place to live, so lived on Gainsborough Street in Boston, and in those tenements. But anyway, we made it all right, and enjoyed it very much. The whole time I was there, had a great experience, I think, in medical school. Mm-hmm. Wonderful classmates, and all, as I said, all the girls graduated, so it was very good. Then came to internship. And
can I interrupt? Did you have a relative who was a doctor?
My brother-in-law was Joe Millen,
Okay.
who was in medicine, and he's the one who directed that I go to medical school rather than osteopathic school.
Okay, I'm sorry to interrupt.
That's
So
all right.
then you did your internship?
So I did my internship and at Hahnemann because I had worked there summers, and turned out it was wartime, so that all of a sudden the other 3 residents that were there went off to war, and I was it for that whole year. Needless to say, we didn't have any time off at all. And you had to scrub in surgery, you had to do everything, actually.
Were you in every day?
Every single day.
And this was what year?
1942.
Wow.
Yeah, so it was tough times, but you were essential, and here were my classmates off fighting the war, and that was the least I could do, I thought, for whatever I could do. Fortunately, Hahnemann was near my sister and Joe Millen's house, so that once in a while I'd get time off to go up there. But at any rate, but I wanted to get on the staff afterwards when I got out I wanted to go to City Hospital, and they had never had any women on the staff. And although my application was accepted pretty well, it went through some rough times because the chief of surgery did not want a woman on the staff at City. But I knew enough people by that time who were on the board and who had worked with me at Hahnemann so that I got on the staff. I needed that because I really wanted to do more service work than what was at Hahnemann, so that I got an appointment in the outpatient and worked at that for a long time, and finally got on to the regular staff at City, which was very rewarding to me because you saw everything, and it was a great help to me in medicine.
So let's back up a little bit again. You were telling me about how you sort of made a decision in your senior year of high school to go into medicine.
To go to osteopathic school.
Right.
Yes.
Had there been any role models in your family?
Well, my aunt and uncle were both osteopaths in Boston.
Okay.
Dr. Marjorie Johnson, her office was on Boylston Street in Boston. And they ran summer camps in the summer, and I was allowed to go to camp. And they were role models for me, really, to start off.
Yeah.
And
good. So you got on the hospital, the full staff at City Hospital.
Yes, that was wonderful for me, I thought, because it was, the need was there, and I had had some experience with children, so that, and we didn't, at that time, pediatrics was under the Department of Medicine, and within a few years we just got the Department of Pediatrics by itself, which was a very good thing to do, and then we were able to get residents and stuff to come.
So you had concentrated in pediatrics right after your internship?
Yes, yes, yeah.
Okay. And at this point, were you beginning your private practice?
Started in practice and had an office in the Medical Arts Building in Worcester and lived on Irving Street. And little tiny office with just an examining room and a small waiting room. But I didn't have room to have anybody help me, so I had no nurse or no secretary or anything, so that it was kind of tough there. But
how long did that last?
Well, that lasted, well, practically all my career in practice, actually. I was there.
You stayed in the same office?
Yeah.
Wow.
Yeah.
Did you at any point have a secretary, or?
Well, I finally had somebody come in mornings when I was at the hospitals and stuff and do the work, but it was my business sense was not there at all. I made enough to pay the rent, and that was enough to. In the meantime, I met Ed at City, and then he went away to do his training, and we were married before he left, actually, and then I began having all these children, one after the other, so that it. But I had to work right up to the time I delivered, actually, and when we took a few days off after delivery to get back to work because that's all we had.
Now, you were practicing in the 40s and 50s at the beginning.
Yes.
And you were by yourself. Were you covering at night with anyone else, or did you cover yourself?
Well, yes. We finally, Pete Kopwich and Dr. O'Connor, Fran O'Connor, was also a big help to me. He was a pediatrician. And so we worked together, and Bob Cox. So after a while, we all covered each other, and it was a great group because we all got along. We all practiced about the same type of medicine, and each one depended on the other. We had a great group, and I felt very welcome in that situation.
So what, on a typical day, you know, once you started in practice and your practice was a little bit established, how would it start? What time would you start off, and where would you go? And
we made rounds, and sometimes you had somebody in each one of the hospitals. I never applied at Memorial because that's where Ed was, and I thought I'd better not, so I went to Hahnemann and City and St. Vincent's. But I never was really on the staff at St. Vincent's. But Dr. Mielek, who was helping me as he was the obstetrician, he'd have a baby and he'd ask special permission for me to go up and take care of it. It was a big, big help to me in starting my practice. So sometimes there was 3 hospitals a day that you went to before you went to the office in the afternoon. So it was kind of busy. And as I say, I was having multiple pregnancies at that time, so I'd take a few days off and then go back to work. It was kind of tough. But I had good help at home. I couldn't afford much help in the office, but I had to put it in to taking care of the children at home. And I was very fortunate that I had the kind of people that I had to take care of the children. And it worked out very well.
Do you feel like you and your husband had enough time to spend with your kids with these busy practices?
Not really. Not really. But the children never knew anything different, so that I don't think even today that they feel the resentment of that because they never knew anything different than Mother was gone. And so they were...
You had a story for me once about you were pregnant and your car broke down or something, you were making a house call.
Oh, yes.
What was
well,
that?
Winter night, of course. And yes, I couldn't get the car started after I came out of the house and slid down the hill by foot to find somebody that could come and help me. But I was very much pregnant at that time. I finally got somebody to come up and help me get it out. But there were many times like that we were always out. And of course, the worst day of the year, you would be out making calls. And in the beginning, I didn't know Worcester, so I'd have to take the city directory and find the streets, and then sometimes I'd have to start with Main Street and get all the way through. But I got to know the city pretty well. Not the west side, the east side with all the 3-deckers and always the top floors, but they were...
But you would make a lot of house calls.
Oh, yes. And I enjoyed doing that. I really think that that's the way I learned about my patients. You saw where they lived, you saw what their problems were, and I really, really enjoyed that part of it.
Great. Okay. So on an average day, how many patients would you see in the office?
On the average day in the office, about 14 to 16.
Wow. And then you would make house calls?
Oh, yes. I would make house calls after. Sometimes, depending on how many I had to do, I would either go home and check on the children and then go out, or sometimes I would go directly from the office. And
Now, this was before beepers, wasn't it?
yes.
When did beepers come in?
Gee, I don't even remember because I never had one.
You never had a beeper?
No.
How would your patients find you?
Well, it was always on the answering service, so I would always call in and get the calls.
How often would you call in?
Oh, depending on what I was doing, I would call at least once an hour to see if there was anything going. And as I said before that, or maybe I didn't say it, that I had a bridge line. My office phone rang in the house. Mm-hmm. So that, and I had an early morning telephone time for patients to call. And so that they just called the office phone and I would pick it up and answer it. And then you could plan your day, whether you had to go and make house calls or see somebody in the office besides the ones that were regularly booked.
Mm-hmm.
But
so you were scheduling your own appointments, you were answering your own telephone,
mm-hmm.
Were you sending your own bills?
No, after a while I got a girl to work mornings so that so when I wasn't there, she could do that type of thing. So that was a big help.
Yeah, okay. And what sort of illnesses would you see early on in your practice? What kind of problems would come to you?
Well, we still had infectious diseases. We saw measles, and you saw all the complications of measles and stuff like that that you saw all the time. There was also, contagious diseases and we had them up at Belmont Hill, and I got on the staff there, and that's where we sent a lot of the infectious diseases.
So if you saw a patient with an infectious disease, you would then send them to a particular hospital?
Not necessarily. You took care of them at home unless they were really like a bad meningitis or something. You'd have to admit, and either it would be admitted to Belmont or to City, depending on what disease it was. But
did you see many cases of polio?
Oh yes, yes. Certainly, polio was a real menace to us at that time, and you always were afraid that you were going to see somebody with that. And when you got a bulbar polio, that was really tough. Mm-hmm. But most of those we saw up at Belmont. And it was very devastating.
Did you see many cases of TB?
Cases of TB weren't very frequent. Okay. I've had one TB meningitis, and I never had a miliary tuberculosis that I remember taking care of. And that wasn't so, this is Worcester, and we didn't have as much. But during my residency in New York, we had wads of TB, all kinds of TB in children.
So you did a residency in New York?
Yes, New York, at Metropolitan Hospital. And it was in the middle of Welfare Island. You had to take a ferry, or one of the bridges had an elevator down onto the island. So most of the time you were there. But it was... So
what was Welfare Island in New York City?
Welfare Island had 2 hospitals on it. One city hospital at one end and Metropolitan Hospital at the other. And they were city hospitals. And as Bellevue is, certainly we had really, really tough cases there, and it was a great experience.
Did you, how long was the residency? How long did that last?
2 years.
And was the work schedule, the call schedule, as brutal as it was during your internship year?
The on and off schedule was a little bit better because we had a little bit more help. But for the most part, we didn't go off the island very much. And you were always there in case somebody needed you.
Okay.
It was great.
And okay, so we were back at your practice, and we were talking about infectious diseases.
Mm-hmm.
And you saw many of them. Did you see rheumatic fever or scarlet fever? Were you seeing much involvement of the heart with these infections, with the rheumatic fever?
You're asking about rheumatic fever and cardiac problems. Yes, we had them. I don't think I saw them as much as we did in New York, but certainly they were there all the time. And I don't remember any real severe cardiac problems in my, but if so, we would have had a cardiologist see them.
What were the patients like that you were taking care of at those times? Were they immigrants? Did they come from this country? Were they of a particular background? Did they work in particular places?
You're asking about my kind of patients I had. And the patients I had were not West Side people in Worcester. They were working people. They were not very many immigrants at that time, but they were poor people and hardworking people. And I love them. They were wonderful patients.
Where did they work?
Oh, in all the mills. Lyman Garden, Norton Company, and sometimes they were out of work, so that they didn't have much of anything. So
now, in those days, when someone didn't have any money or had very little money, how would they obtain their health care?
Well, I was never very good at collecting bills. If people couldn't pay me, it was not any skin off my teeth not to charge them, because I had a poor practice, and I knew that they would pay if they could. And it was better that I have that relationship with the patient rather than wondering how much money I was going to make.
What about other things, like getting medicines or going to the hospital? Were there limitations there?
No, not really. Being on service at City Hospital, you could always get them admitted, even though they had no insurance. And they got good care. And the same with Belmont for their with infectious diseases. And Hahnemann was a private hospital, and that's where most of my private patients went. But once in a while, you'd have somebody who couldn't pay, and I never delved into it to see how much the hospital lost on them or whatever. But it was.
And when things changed in the mid-'60s and they came out with Medicaid, did you notice any change in the way medicine was practiced or in your practice or anything like that?
You're asking about Medicaid and whether that made any difference. I don't think it made any difference in my practice at all, really. I think I got, as I said, I was not a good businesswoman, so that I didn't pay much attention to what was done.
And did you notice many changes in the medications that you could use when you first started off in practice versus as the years went by? What were the typical medications that you would commonly prescribe when you first started in practice?
Well, you're asking about medications and that we had in the beginning. Sulfa was what you had, and then went through all the sulfa drugs, and we used those for years. Penicillin was a big help when it came along because it did so much for the strep, and we were very, other than that, but it was a big thing to be able to prescribe something like that for them. Mm-hmm. It was very good.
And vaccinations, how have those changed over the years?
Well, thank God, our whole immunization vaccinations are very good. I've seen not doing the smallpox vaccinations anymore, but we probably are going to come back to doing it pretty soon. And to have all the things that we can do now to prevention of this is certainly, seeing that whole development of that was just wonderful.
So when you started in practice, were the typical visits to your office children who were sick or well child visits?
They were mostly well child visits. And I frequently got teased by my brother-in-law and so, oh, you're going to go down and measure and weigh those babies again. And that was the way they thought about it. So it was that. And if somebody was sick, you went to the house and saw them. And then later, when transportation got a little bit better, you could meet them in the accident room in the hospital and save a lot of time from house visits.
What about the living conditions in Worcester? Have those changed over the years? Has that affected the health of the children that you would care for?
Oh, yes. Some of the places where I went on house calls, and you never could get in the three-decker up the front way. You always went into the back of the house, and you kicked over all the cans and everything else on the way up. I think things have, I hope things have helped a little bit, have changed on that side. But I saw the worst of it. And you made do, and it, as I said before, that I think it helped when you made that house call and you knew where those people came from and what they had to contend with. It was better to diagnose and to see what their problems were.
Typical family would have how many children then?
3 or 4 children.
And
well, sometimes they were up to 7 or 8. I remember one night making a call, and there were 7 kids, and there was something wrong with every single one of them. It took me all night to go over every one of them. Naturally, I didn't get paid on that one, but they were poor people.
Sure. Mm-hmm. And childhood deaths. What changes have you seen there? Were children dying more frequently early on in your practice?
Oh, I think so, although I never really lost an awful lot of children in my practice. Thank God for that.
As changes occurred in the practice of medicine, do you feel that those changes were promptly available in Worcester? Were you able to feel like you could practice the medicine that you were learning about?
I think Worcester, you're asking about whether Worcester had availability. I believe that they really We really did. At least I like to think so, because we tried. Once in a while you'd go to a pediatric lecture somewhere and there was something that you didn't, but we made sure that we got it pretty soon.
And as changes occurred in medicine after you finished your residency, how did you keep up?
Oh, well, we went to meetings all the time. We went down to Children's Hospital. You took courses regularly. I'm still taking courses. Medicine, you have to in order to keep up with things, so that we did that regularly.
Great. And do you feel, as the government became involved with healthcare in the 60s, what was your attitude towards that, and what did you perceive the attitude of your contemporaries towards that?
I really haven't given it very much thought. I don't think it changed my practice at all, and I don't think my colleagues had made that much difference either.
Mm-hmm.
Actually, no.
Okay, and what about the occurrence of HMOs in Worcester? What are your recollections regarding that? How did that affect you?
Well, I was not involved in HMOs in any way whatsoever, so that I really never. We had our own little group, and we weren't in HMOs.
Did you belong to Central Mass Healthcare?
Yes.
Okay. Mm-hmm. So different managed care insurance companies mm-hmm. started in the late 70s, mm-hmm. and you did participate in
Yes, yes.
Did those kinds of payers affect the way you practiced at all, or just
not at all?
Did they affect the way you ran your office?
No, not at all. No.
So you didn't encounter any limitations from this?
None at all.
Did you ever have patients who had to change doctors because they changed to an insurance plan that you didn't have?
Well, that occasionally happened, and that people would have to go because their insurance was covered under something or other, but not very much.
Okay. And I should have covered this earlier, but do you recall, just in paying for your schooling, what it cost to go to Tufts back in the 40s?
Yes, indeed. It was $300 tuition for college, and that was pretty hard for my family to come up with. But they managed, and of course medical school was $500, I believe, when I started, and that was even more for them. But we managed to pay without any problems because of because I had a saving mother who could save mm-hmm. a lot of money.
Great. And I'm just going to pause. Okay. How do you see Worcester as a community having changed over the span of your career? How have people changed? How has the city itself changed?
Well, I think job opportunities have been greater. I think it's been a very good city for the working people. As I say, I never had a West Side practice, so that or only a few patients here and there, but I don't think it helped or hindered my practice in any way whatsoever, whatever the economic problem was in Worcester, because we saw some of the big companies closing up, which made a big difference to people.
The ethnic background of your patients, has that changed over the decades?
Ethnic background of my patients, I don't think that changed. I had a real mixture. I unfortunately don't speak Spanish, so that I'm not as comfortable or wouldn't have been, and I didn't have too many in my practice as you would have today. I think we've had such an influx of Spanish-speaking people, and I see them now in the clinics all the time, coming into Worcester, which is...
Now you practice at the Public Health Department.
I do the immunization clinics for the public health 3 days a week.
And when did you stop your office practice?
In the 60s. No, I've forgotten when I retired, to tell you the truth. Yeah.
Probably 5 or 10 years ago?
Yes, yeah.
Okay. And as far as the families go, did you notice that the parents of your children, were there more single parents now than there were in the 40s and 50s?
Well, I think that is the single parent families are almost the norm for the underprivileged and somewhat. And
did you encounter, do you observe any changes as far as smoking goes in the household? Was that common in the 40s and 50s? Was it common later?
Oh, I think there's been an increase, although in the last recent years, I think that there has been some cessation in young people starting up smoking. I'm hoping at least that. And as a school physician, which I was, of course, it gave me an opportunity to, when I was doing those physicals, to talk directly to children about, at the junior high level particularly, not to stop smoking.
How common was it in the 40s and 50s for teenagers to smoke?
I don't think it was not very common, I don't think, in the 40s to have teenagers smoking. I don't think they could have afforded it.
Yeah. And now, how common do you think it is?
I think it's very common.
Yeah. Yeah.
Unfortunately.
Drug use, did you see much in the way of drug use in the 40s and 50s by either teens or their parents?
I didn't see it, no.
And what about more recently in the past 10 or 20 years?
I think that would have changed. I think there would be a lot more drug use.
Okay. This wouldn't affect a pediatrician too much, but let's sort of draw a little circle around. Have you seen the emphasis on women's health care change at all, or access to health care for women change at all?
I think women's health care has improved a great deal during my span of years of being in medicine. At least I hope so.
What about, you talked about some resistance that you encountered in getting on the staff of City Hospital. Now, as far as in your family goes, did your family ever have any hesitation about recommending you to become a physician? Did anyone say, well, maybe you should be a nurse or a secretary or something such as that?
My family were behind me 100%. As I said in the beginning, my brother-in-law was Dr. Millen, and when I said I was going to go to osteopathic school, he was the one who said immediately, you ought to do it and go into medicine. If you're going into medicine, you ought to do it the right way. So that that was the option I had. I admired my aunt, who was the osteopath in Boston. She had a very lucrative practice. But
and what about getting into medical school? Was there any resistance there at all?
No, I said they took 8 women in my class, which was not heard of. And as I say, the dean apologized all the time for taking 8 women, but we all graduated.
Okay.
Yeah.
And once you started your practice, once you had finished your training, you'd established your practice, was there any resistance on the part or attitude on the part of patients or your colleagues regarding your gender?
There wasn't any resistance among my immediate colleagues for me to practice. In fact, I got all the support in the world from them. And as I said, there was some resistance in the higher echelon of medicine, maybe, but I never personally took that at all, because I felt very confident that I'd had good training and that I had a place for it, and so that did not really personally bother me, except to feel kind of sorry for somebody who didn't want women in medicine.
What about the public perception of doctors over the years? How do you feel that either you personally or physicians in general were held by the public, and how has that changed over the years?
As far as women are concerned, I think we've come a long way. And now the admitting classes at the medical school are more women than men, which in some ways I don't think is right. I think that we should have, or continue to have, as many men in the practice of medicine. And I don't know how to answer any more of that.
Well, do you think that women bring particular strengths or men bring particular strengths to the practice of medicine?
Well, as a woman, I think that we pay a lot of attention to details about a patient, and you want to know more about them. But I must say my colleagues that I worked with in pediatrics were certainly, I'm sure, better than I was as a practicing physician, and I admired them and learned a great deal from them, and we all helped one another. It was just great. Mm-hmm. And I do think that women have a role in medicine. I don't like to see them encompassing more than the men. I think certainly there's a place for both.
Do you feel that the public, the esteem with which doctors are held by the public has changed over the years at all?
Yes, I kind of think so. I think in the earlier years as a physician, you were really looked up to in the community. I don't think that's necessarily so anymore. I think that we're just as well educated as the guy that's doing the bricklaying in the, in the profession.
Do you feel that the patients you had when you started in practice were with you for a longer time than the patients today? Was there a greater turnover of patients in the past 10 or 15 years?
The turnover of patients, I think, may be more today than it was before, but I think that depends an awful lot on insurances and how they affect. So people would have to leave you because they were covered by a certain and had to go a certain way in medicine. Mm-hmm. So that I think changed things. People who had been patients for a long time had to leave and go because of something of that order. But I don't, I think that's more prevalent now.
So that may prevent some of the attachment or bonding that could occur between
Absolutely.
doctor and patient.
Yes.
What do you think were the biggest advances in medicine over your career? What things strike you as being the most...
Well, the development of the drug industry to be able to treat something with a particular drug. And the diagnostic facilities have certainly improved a great deal. All our technical accomplishments in the medical field, I think, have helped a great deal.
Do you recall what malpractice insurance cost when you first started in practice, and roughly what it was when you finished?
Well, I never paid much, it seemed like. $300, I think it was, or something like that, for malpractice insurance. And I don't think it changed much.
Now, has the environment regarding malpractice affected you at all? Has it affected your thinking about how you treat patients?
Malpractice and how I treat patients, I don't think that I let that interfere with my practice of medicine. If you knew you were doing the right thing, and then everybody can make a mistake and get blamed for it. But fortunately, I never had any suits.
Again, just going over general things here, do you think, well, what do you like most about Worcester? What do you like least about Worcester?
Well, now I have to think about that. Number one, I had to come to Worcester because I didn't think that my hometown was ready for a pediatrician, so that having my brother-in-law and sister here made it easy for me to start practice here, and I got a lot of help. And the fact that I interned here, I got an awful lot of help from. So I never thought about going anywhere else. I never thought about staying in Boston, for instance, although we had opportunities when we were graduating to go on the staff at Boston City and so forth. Never occurred to me to do that.
And what do you like least about Worcester?
Well, Worcester's been very good to me, so that it's hard for me to... I really don't look at it as anything bad about it.
Okay. Did you have, when you started off in practice, did you have any particular doctors that you particularly admired or looked to for advice?
Oh, when I started practice, naturally, I looked at the people who I could refer things to that were top-notch in my mind. And for instance, the surgeon who would be going to do the appendectomy on the child that you were seeing, and the subspecialties, I think that they were a very excellent group of people, the dermatologist and so forth that you had. They were fine.
Your coverage group, the doctors that you worked with, did they start in practice around the time you did, or did they start before you did, or?
Well, Bob Cox and I started at the same time, and then Pete Kopwich came along, and early Ani Gerwitz was later. But, so we all had about the same kind of background to some extent.
Would you get to confer with each other about cases at all?
All the time.
You did?
We'd have coffee together after making rounds, and you always shared your problems with them. Well, if they were covering particularly, but even if they weren't, we talked it over. and learn from each other a great deal, I think, with the whole system.
So you would meet with them how often?
Every day?
Every day for coffee with
Sure,
a standing meeting.
Sure.
That's great. And do you have any particularly fond memories of your practice, particular instances or episodes that stick out in your mind?
Well, there were a lot of very, very wonderful feelings about being a pediatrician in Worcester and being able to help in some of the situations that you'd get yourself into, so that I couldn't really name an awful lot of them. But the sadness that you get when somebody had something incurable that you couldn't do anything about would last with you forever, you know. But it was a joy to practice medicine as far as I was concerned.
When you first, as far as the cost of healthcare goes, when you first started off in practice, do you recall what an office visit would cost?
It was $3 for an office visit and $5 for a house call.
Okay. All right, and that's changed quite a bit over the years. Do you recall what it was when you finally retired?
No, because I never changed mine.
Okay. All right. And
all right, sorry.
Do you have any particular advice for people who are going into medicine now?
No, I think that they should be sincere in their work and really appreciate what's been given to them to be able to help people. I think that there isn't a greater joy in life, I don't think, than to have the role of a physician in society. That's the way I feel about it. And
That's terrific.